This part of the lab will be focused on the foot specimens. So we're actually looking at museum specimens here on the table. First of all, on this freeze-dried specimen, this is the forelimb. And so you've got the coronet that we talked about previously, is the skin to hoof transition here. And then on this hoof, you can actually appreciate a little bit of the periopal. So it's kind of this waxy substance that's right underneath the coronet. Here it's kind of flaking off. You can't see it very well, but this would be the periopal, and periopal would be here. All right, so then on the hoof, this is obviously a hoof, and you have the wall. So the wall is all of this, but we have different regions that we want you to identify. So I'm going to turn it over and look at the distal surface here. So you've got the toe, which would be this third. It's kind of arbitrarily divided into thirds, but the distal third here is the toe. The middle part is the quarter, and then the caudal part is the heel. So your heel actually has a couple of other things in it as well. So you have the bulbs, which are kind of at the very back here. So bulbs, you have the bars. This doesn't have very distinct bars, but these are the bars here. And then in the middle here, you have the frog. So this would be the frog. You have the apex of the frog. And then you have the collateral sulcus on either side. So there's two of them. So here's a collateral sulcus. Here's a collateral sulcus. And here we have the sole. So here in between the hoof wall and the frog is the sole. There. All right, so the frog, we had the apex that we talked about, and then we also have the central sulcus of the frog, which is here. The white line is hard to appreciate on most of your hoof specimens, but it will be right here along this line where the laminae would come together, so that would be called the white line. And then we'll turn the hoof over. So here inside the hoof, I'm hoping you'll be able to see this, but the horny laminae are these kind of sheet-like structures inside the hoof. So you can call them horny laminae, or they can be called insensitive laminae inside the hoof here. And then you also have this coronary groove. That's kind of this indentation around the top part of the hoof here. So coronary groove is there, and then we'll look at the plastinated specimen that kind of goes along with that. So the hoof would be over the top of this. This is inside the hoof itself. So that coronary groove corresponds to this coronary band, or the coronary dermis, it can be called. So that sits in that coronary groove inside the hoof. Here we have the sensitive laminae, which can also be called the laminar dermis here, and those interdigitate with the horny laminae or insensitive laminae inside the hoof. So those can be seen there on the plastinated specimen. All right, so we'll bring out another plastinated specimen. I'm just going to kind of move these to the side for the moment. And another plastinated specimen we want you to see is this. So this is the P3, so P3 bone. And you have on the sides the collateral cartilages. So here's a nice plastinated specimen that has the collateral cartilage intact. So that's just on the side, so it has it on both sides. The other side has been cut off. But in your specimen, you can usually palpate them on the sides of inside the hoof. So you would have the hoof around the top here, and you just kind of feel on both sides for those collateral cartilages. So that's a nice specimen of that, to see the collateral cartilage there. And then we need to look at the split specimen. So I'm going to put these over here. One other note on the collateral cartilages while I was talking about it. This is a big draft horse foot, and so this was P3, and it's been taken out of the hoof. And here you can see those collateral cartilages have ossified. So they're actually bone now, and they're called side bones, is the layman term for it. So side bones, and they're just an ossified collateral cartilage. Okay, so then we'll take a look at this specimen that we looked at the lateral side of. Now we'll flip it over, and it's been split and freeze-dried. So here is the sectioned part. So we're looking inside the foot. And we basically want to see some of the structures that are inside the foot that we can't see from the outside. So here's obviously the hoof wall, so we're looking at the hoof there. Here you want to see the digital cushion, so this part is the digital cushion right there. Here you have your flexor tendons, so those would be your deep digital flexor tendon here coming down. And we have P1 and P2 and P3, so those are all the phalanges there. Here we see the navicular bone, and in between the navicular bone and your flexor tendon you have this navicular bursa, so that space right there. So I'll actually stick a little pin in it to try and show you that. But it's basically just this space right there. So the pin is actually sitting in it, not the pin head, but the pin itself is in the navicular bursa there. All right, so then we need to look at some of these joints, and we have the dip joint, distal interphalangeal joint, which would be this joint in between P2 and P3, so dip joint is perfectly acceptable. Then we also have the PIP with a P, PIP joint, proximal interphalangeal joint here, so in between P1 and P2. So PIP joint between P1 and 2, dip joint between P2 and P3. Then we also have this, I'll just remove this from that navicular bursa, and we have the distal sesamoidean impar ligament. So right here is attached to the navicular bone, so navicular bone is here. The distal sesamoidean impar ligament, very long name for a very short ligament, right there.